The Da Vinci robot was initially developed for use on the battlefield so that you could have a remotely controlled equipment doing an operation on the battlefield, and it was pretty clear that that wasn't ever really going to pan out. And the technology was really acquired by a company that really developed this platform that allows you to miniaturize the instruments in the surgeon's hands and arms and transport them inside a body on the end of a stick, really a long stick, through really small holes. And what that does is it allows you to make a lot smaller incisions in the body, whether it's for urologic surgery or for heart surgery or any kind of surgery. And in addition to being less traumatic because the incisions are smaller, the computer gets rid of a surgeon's tremor, so it allows for really precise motions, and you're able to light the area a lot better, and you have about a 10 to 15 power magnification, so anything you operate on you can see a lot better. For us, we use robots for a number of different operations. I think the most common one is mitral valve repair. And what the use of the robot does is allows us to avoid dividing the breastbone, splitting it in the middle and making a big incision. And instead what we do is we make a series of 5 stab wounds. The biggest one is about 3/4 of an inch long, right around the right breast. So in a woman, when you're done with the operation, for example, it'd be hidden in a bikini. And that's one of the advantages, is that you can do this, and it's cosmetically really a superior incision. But really more importantly, the advantages are that you can repair a lot higher percentage of valves. Nationwide, about half of all mitral valves that are leaking get repaired through a breastbone. And our current repair rates for mitral valve leakage are almost 100%. They're just shy of 99%. The reason that's important is that people tend to live longer and live better if you can repair as opposed to replace the valve. You also get better a lot quicker. The typical recovery after sternotomy approach is about 2 to 3 months, and the older they are, the longer it takes you to recover. And if you do it without dividing any bones, then your recovery is shortened to about 2 weeks. You can be back at work doing just about any activity in 2 weeks. You don't bleed as bad, so you don't get as many transfusions. You've almost eliminated the risk of infection. And those are really the major advantages for a robotic mitral valve repair. I think maybe another one that is, likely to be true but not proven to be true, is that for really sick people with really bad hearts that have a leaky mitral valve, you're much more likely to survive the operation if it's done through this small approach as opposed to the dividing the breastbone. The other operation that I guess the second most common operation done with a robot in terms of heart surgery is a bypass operation. And the primary advantages to that is really the avoidance of the breastbone incision. You actually operate on the left side of the chest for a bypass operation, and you end up with 2 small stab wounds that are less than a centimeter in length, and 1 small incision that's about 3 centimeters in length. And instead of having a 2 to 3 month recovery, you're looking at about a 2 to 3 week recovery from a bypass operation for that. It's actually a little harder to do than a valve repair, but when it's done correctly, you really see a lot of advantages. In terms of recovery, you bleed less. Again, the risk for infection is almost eliminated. I think cosmetically it looks nicer too. The other sort of more esoteric operations that you can do, you can take tumors out of the heart. You can repair holes in the heart. So you can do a lot of different things with a robot minimally invasively in terms of heart surgery.